Symptoms of death. Death is defined as the end of life, permanently discontinuing all major vital functions of the body, as well as complete brain death with its torso, or permanently discontinuing respiratory and circulatory functions, and untreatable. The death is also approved in accordance with approved medical standards. Symptoms of death precede the death of a person with the leading disease, the appearance of many symptoms and signs indicating that it is approaching, and the most prominent of these signs and symptoms. Anorexia, where death is usually preceded by a general weakness in human activity, which reduces his appetite and need to eat as a result of decreased energy need. At the last period before death, you may stop eating completely, at which point your lips should be constantly moisturized so as not to cause discomfort when dry. Increased sleep hours, due to a decrease in the effectiveness of metabolism and energy in the human body. You usually notice an increase in sleep between 2 and 3 months before death. You should be encouraged to move and ensure that your bed is comfortable to sleep. Lack of social interaction. Due to the lack of energy in the body as well, a person tends to stay at home and not socialize with those around him. It is their duty to arrange visits so that he does not remain alone for long periods before his death. Changing vital signs. A person about to die may experience a drop in blood pressure, or heart rhythm disorders. These impulses may become blurred when heard, and urine may change to brown, which can be a sign of kidney weakness and starting to stop working. Changes in excrement habits. We have previously stated that the amounts of eating and fluids may decrease in the near-death human body, thus resulting in the need not to direct and urinate as before. And this process may stop once and for all if the person stops eating and drinking permanently. Muscle weakness. The approach of human death is sometimes accompanied by general muscle weakness, which may prevent it from carrying out the simplest activities, such as lifting small objects or fluctuating on the bed. Hypothermia. Due to poor circulation, it focuses on important internal organs instead of the entire body, causing colder limbs, pallor of skin color, or blue or pink spots. It is worth mentioning that the patient may not feel this cold, so be careful to warm his body with appropriate means. Confusion. Before they die, some people may experience a blurred mind, poor interconnection of their thoughts, and lose focus and awareness of what's going on around them. Breathing disorder. You may experience sudden changes in breathing rate so that your breathing rate becomes rapid or with some stops. Increased pain. Pain and associated sounds can increase as a person approaches death, and you should consult your doctor about the need to give him medications or painkillers. Hallucinations. A person may suffer from hallucinations and distorted fantasies before his death, and it is better not to correct what he says, because of the negative impact on his psyche. The most common causes of death are multiple causes of death and the diseases leading to them, and some of these diseases and causes are more life-threatening than their counterparts. According to a 2016 WHO statistic to determine the most common causes of death, it was found that about 54% of the 56.9 million globally recorded deaths that year were associated with 10 major causes, so they were called the most common causes of death, as mentioned below. Ischemic heart disease causes narrowing of the heart muscles nourishing arteries, thus weakening the heart's oxygen levels, and may cause heart attacks on death. Stroke. When it breaks, it supplies blood to part of the brain and its nutrients and oxygen. It should be noted that stroke affects part of the brain cells, leads to death within minutes, and may cause human death. Chronic obstructive pulmonary disease, a type of chronic respiratory disease, causes difficulty breathing to varying degrees in people with COPD. And the main cause of COPD is prolonged exposure to substances that irritate the lungs and damage their cells, such as air pollutants, chemical fumes and cigarette smoke. Lower respiratory infection, diseases that affect the lower larynx parts of the respiratory tract, including pneumonia. bronchitis and bronchitis common in children, are the most common infectious diseases causing death. Suffering from Alzheimer's and dementia. Alzheimer's is known as a disorder that affects brain cells and leads to their death. And the subsequent weaknesses in memory, concentration, and thinking ability. Which is one of the leading causes of dementia. Lung, bronchial and bronchial cancer. Cancer is an abnormal cell growth with more than 100 types, but the cancers mentioned are the most fatal. Diabetes, this name is given to a range of diseases that affect the body's treatment of sugar, leading to high blood pressure, thus complications and health problems in the patient that may cause death. Road accidents, where accidents caused. We have reached the end of the video. If you have any idea for the upcoming videos, or criticism for the development of the content, do not skimp on me and write it in a comment and I will be thankful to you.